Tonight, you feel a toothache. The pain throbs behind your jaw. It pulses with every heartbeat. You cannot sleep. You cannot think. You press a rag to your cheek, but nothing helps. In a few hours, you will call a dentist. You will sit in a chair. A professional with years of training will numb the pain, drill the cavity, and send you home. You will barely think about it. But what did ancient humans do when they had a toothache? Picture this, nearly 60,000 years ago. No dentists, no anesthesia, no metal tools, just stone, just ice, just agony. Deep in a Siberian cave, during the last ice age, a Neanderthal is dying, not from a mammoth attack, not from starvation, from a tooth. A deep cavity has eaten into his lower right first molar. The infection is spreading to his jaw. The pain is so intense that he cannot sleep, cannot think. He has tried everything. He has used a small stick to pick at the decay. Scientists can still see the toothpick grooves on the tooth, but nothing helps. The pain only grows. So another Neanderthal picks up a sharp piece of stone, a pointed jasper perforator, no bigger than your thumbnail, and they do something that should be impossible. Siberia is not the frozen forest you imagine. It is a harsh, brutal grassland. Glaciers grip the mountains. Woolly mammoths roam the valleys. Inside the Chagarskia cave in the Altai Mountains of southwestern Siberia, a small group of Neanderthals huddle around a fire. They are not primitive brutes. They control fire. They make complex stone tools. They care for their sick and elderly. And one of them is in agony. His name is not recorded, no one wrote it down, but his tooth survives. It sits in a museum today, labeled Chagarskia 64. A single tooth waiting nearly 60,000 years to tell us what ancient humans did when they had a toothache. In 2026, researchers examined the tooth under powerful microscopes. What they saw left them stunned. The study was published in the journal PLOS ONE, and the findings made headlines around the world. There was a carefully drilled hole going deep into the cavity, straight toward the pulp where the nerves and blood vessels live. The hole was not random. It was intentional, deliberate, surgical. Microscopic analysis showed 3 overlapping drill marks. Someone had worked on it in stages. Pause, drill, pause, drill. This was not a single desperate act. This was planned. To prove it, the team took modern teeth and used stone tools identical to those found in the same cave, pointed jasper tools. They drilled, they measured, they timed themselves. It took 35 to 50 minutes of slow, precise work. Think about that. A Neanderthal in the dark, in the cold, with nothing but a sharp jasper point drilled into another person's tooth for nearly an hour. Let that sink in. And here is the most incredible part. The patient did not die. The tooth shows clear signs of healing. The polished edges of the cavity prove the drilling happened during life, and the individual continued chewing afterward. The Neanderthal lived for years after the procedure, using that tooth to chew, to eat, to survive. Someone cared enough to help. Someone had the steady hands, the patience, the courage to push a stone tool into another person's mouth while they screamed. And the patient, the one in agony, trusted them. No anesthesia, no metal, just stone, skill, and trust. This single tooth pushes back the history of invasive dentistry by over 45,000 years. The previous oldest evidence was only 14,000 years old. This is what ancient humans did when they had a toothache. Not prayer, not magic, with courage, skill, and trust. Neanderthals were already known to control fire, to make complex tools, to care for their injured and elderly, to possibly create art. But this is something else. This is medicine. This is the oldest known dental surgery in human lineage, performed not by modern humans, but by our close extinct cousins, the people we once dismissed as primitive brutes. Think about what this actually means. They understood that rotten tissue inside a tooth causes pain. They knew that removing it could bring relief. They had the fine motor skills to craft a tiny jasper point manipulated between thumb and forefinger and drill into a living tooth without shattering it. And they had the courage, both the patient and the surgeon, to endure a long, painful procedure without any anesthesia. Most of us walking around today carry 1 to 2% Neanderthal DNA. Their ingenuity is still inside us. When you feel a toothache, that same ancient instinct kicks in. Get the poison out. But here is the dark twist that most articles leave out. We don't know the name of the patient. We don't know the name of the one who held the stone tool. We don't know if they were family or friends or strangers bound by survival. We only know the tooth, and the tooth is silent. The cave is empty now. The fires are cold. The Neanderthals are gone. They didn't leave behind written records or monuments. They left behind stone tools, bone fragments, and one tooth with a hole in it. And that hole is all we have. Every fortune has a cost. Someone always pays it. The patient paid with his agony. The surgeon paid with her steady hands. The Neanderthals paid with their place in history, dismissed as brutes for centuries until a single tooth proved everyone wrong. From a clinical perspective, this finding is extraordinary. The Chagarskia 64 tooth represents the oldest known operative dental procedure in the human lineage, not extraction, not palliation, cavity preparation. The same fundamental principle taught in every dental school today. Remove infected tissue to preserve function. The Neanderthal practitioner understood 3 things that modern medicine takes for granted. 1. That infection localized to the pulp causes pain. 2. That removing the infected material could provide relief. And 3. That the tooth could remain functional afterward, which it did for years. The tool was stone. The time was nearly 60,000 years ago, but the surgical logic is identical to what your dentist uses right now. This also raises a clinical question. How did they manage pain? No local anesthetics existed, no nitrous oxide, no opiates confirmed at this site. The patient endured 35 to 50 minutes of drilling on an exposed nerve, conscious without pharmacological relief. That's not just surgical skill. That's an extraordinary pain tolerance threshold, or a profound level of trust, or both. For medical professionals, this case is a reminder. The core principles of surgery, diagnosis, intervention, and preservation of function did not begin with modern civilization. They emerged deep in the Pleistocene in the hands of our closest extinct relatives. The next time you perform a procedure, remember, you're not inventing something new. You're continuing something nearly 60,000 years old.